All right. Well, welcome everyone. Thanks for joining us. Look forward to a great meeting. So I just want to quickly introduce you to the current leadership of the eSTAR committee. Deidre, who will be leaving the seat, myself and John Rooney, and then our HESI staff, which are invaluable to our progress in keeping us rolling, Connie and Chrissy. Next. Us. And thank you to all the work group leads, me being one of them. I hear you. You were all wonderful, and you really helped move keep things moving. And we look forward to hearing from you today. Next. So, as I just noted, Deidre is leaving us, sadly, on the leadership group. A huge thanks to Deidre for her service. Deidre served as the eSTAR chair since 2021. She has been actively involved in all 6 projects. I think that might be a record. She brings pharma and genomics expertise to the committee. She's instrumental, and she was instrumental in launching, I think, what the biggest project we have, correct me if I'm wrong, the OASIS Consortium, and she helped write the grant. Just personally serving with her, Deidre brings a great perspective from Pharma. Plus, for us who have evolved into desk jockeys, Deidre's managed to stay in the lab, so she brings really valuable insight in that way. She sort of pushes back on you when you're not being so enlightened as if you were in the lab when you were a grad student. So she keeps both the expertise in the informatics and also the expertise at the lab level. So thank you very much, Deidre. You'll be missed. Next. Next, I'd like to welcome John Rooney, who is a collaborator of mine and I've known for many years. He was selected to be the eSTAR co-chair on the private side as the successor to Deidre. He is a toxicogenomics expert at Syngenta. He's been involved in eSTAR for 3 years now, and he's actively involved in 2 of the work groups, carcinogenomics and the TPOD group. And many of you will probably know John by his work that he did when he was with Chris Corton and producing all of those wonderful mode of action signatures that all of us like to use in evaluating our genomics data. And I'm no doubt he will be adding more to that corpus of work in the future. Next. So just a quick review of our mission in the Emerging Systems Toxicology for Assessment of Risk, or eSTAR. First is develop and deliver innovative systems toxicology approaches for risk assessment, catalyze adoption of new translation and predictive tools that guide decision-making based on mechanistic understanding of toxicological response, and then finally to support identification of biofluid and tissue-based genomic biomarkers for toxicology. Next. So I'd like to acknowledge all the contributors that we've had over this past year, and many of who have been involved for many years. We have 17 academic institutions represented across the work groups, 10 from government and 2 from nonprofit. Again, this is the public sector. And often these people contribute expertise, time, and some of them are actually carrying out experiments and sharing samples. It's been really wonderful. And the same is true for the private sector, which is the next slide. We've had 24 private sector participants also making some very significant contributions and also supporting financially the efforts in HESI. So we thank them very much for their support. Next. So there, as you heard earlier, there are 6 eSTAR working groups. The molecular point of departure working group, which is in the upper left there, is working through basically their think tank on how to use transcriptomic points of departure for chemical risk assessment, identifying human protective points of departure using transcriptomics-based analysis. The carcinogenomics group is focused on identifying and evaluating transcriptomic biomarkers for rat liver tumors, similar to what John was working on with Chris Corton a number of years ago. And the goal is to reduce the need for 2-year carcinogenicity studies. Next, OASIS is exploring the use of cell painting transcriptomics proteomics proteomics for safety assessment. This is a relatively new project, and it is one of our largest. TGX DDI is, I believe, probably our longest lasting legacy project, and has actually seen a great evolution over time, but it was focused on developing on an in vitro transcriptomic biomarker to detect DNA damage. And it is now going through the process of that transcriptomic biomarker is now going through the process of being approved as a test or a biomarker at the FDA. The error-corrected sequencing group, which is relatively new, they are exploring the use of error-corrected sequencing to detect non-genotoxic carcinogens. And so there's actually a separate working group evaluating error-corrected sequencing for genotoxic carcinogens. That's in the GTTC. This one is focused on using the error-corrected sequencing technology, or I believe there's other names for it now. We'll hear from Barbara Parsons later, who has her own variation on this technology, which in this case will be evaluating basically clonal expansion of known mutations in cancer to detect non-genotoxic carcinogens. And then the microRNA biomarkers group is investigating and evaluating the use of microRNAs as biomarkers for renal injury. Next. We'd like to highlight the eSTAR webinar series, which we had one presenter this year, which was an amazing presentation. There's a link down here to the presentation. It was done by Dr. Jesse Salk. And he spoke on emerging spatial genomics and in situ sequencing technologies for carcinogenesis assessment. What was really amazing about this, and I don't know how many people saw this, but I would urge you to go watch it. But it's the integration of error-corrected sequencing with single-cell sequencing, so you can actually look at sort of tumor evolution. So you can look at the landscape of the tumor and look to see where there are certain driver mutations occurring in certain cell types. It's incredibly powerful technology, and I imagine there are going to be many applications for it in the future to understand pathogenesis, particularly in cancer. And in our case, being toxicologists, potentially preneoplastic lesions. We'll also highlight, if you go to the link associated with this QR code, there's a number of webinars associated with each of the work groups. And if you have any ideas for webinars coming up, please email Connie. Her email address is here. Next slide. So we've done quite a bit of...
Sorry.
Sorry, go ahead.
Okay, sorry. So what we have, thanks, Scott, for going through the beginning of our overview. So this is just really an overview, and we've had a lot of outreach throughout 2024 already, and that will continue. So we've had a lot of different presentations, posters at the various different society meetings, such as Society of Toxicology. We presented some data on the OASIS Consortium, point of departure, and as always, talk about kidney, usually at these events. Some Eurotox, we had some evaluations there and some posters on the point of departure group by Karen Lament. And then for EMGS, we had Cameron Johnson and Logan Everett, as well as James Alcaraz. I'm really talking about point of departure and error-corrected sequencing. And then coming up, moving forward throughout 2024, which will be next week, we have a poster at the ACT meeting, really going over a number of our different projects that we have and ongoing, so such as OASIS, the kidney microRNA work group, as well as some of the carcinogenesis efforts that we have ongoing. So we really do have great outreach, and if there is anyone who is attending those meetings, please stop by our poster at the ACT meeting. So throughout the year, we've also had a number of different papers that we have published across various different journals and manuscripts. And two of those you can see on the screen. The most recent ones are a paper in regulatory toxicology and pharmacology, and that really focused on urinary microRNA biomarkers and really looking in the monkey to try to identify biomarkers of nephrotoxicity. And that was published in August. And then our most recent one, which we have was just published earlier this November, is really focusing on bioinformatic workflows and trying to derive transcriptomic points of departure. And that was through the POD working group. So please, if you have a chance, read those articles and manuscripts. There's a lot of great information within there. And as always, we are trying to promote HESI and get as much information out there that we can. So it's a great aspect of HESI where we do get the ability across the various different work groups to be able to publish. And then just a quick overview of our budget that we currently have ongoing. So I'm not going to go through all the details, but really looking at just a high level summary. So currently throughout 2024, we had maintained and we have 24 sponsors. Each of these sponsors pay $8,000 per year to join. And we thank everybody for your continued contribution within that. And then throughout this year, we also did, as Scott mentioned, we did get the OASIS grant, and that was a $1.2 million grant from the Massachusetts Center for Science, and it was the Bits to Byte grant. So it was a lot of effort by everyone, all the vendors, all the academics, industry partners to be able to get that award. And that was also matched by approximately about a $2 million contribution from our industry partners. And overall, it's about a $4 million effort. And I'm truly thinking at the benefits of cell painting and integration for various different aspects of toxicological risk assessment, integrating omics and complex in vitro models eventually. So it's quite a big effort that we were able to accomplish. But the budget that we do have for that was greatly supported by a grant. So that was a great accomplishment for 2024. And then over our major expenses for 2024 is really looking at, management of the various different committees. And of course, our great project leads that we have, such as Connie and Chrissy and others that support us, plus including, our legal, financial, and administrative support, as mentioned. I think this is, a great effort by everyone. In addition to that, HESI does support a lot of experimental work in and of itself. So we sponsor various different aspects across the different working groups. While we do have money coming in from the various different partners that we have, and that is spent on various different studies that we need to do to accomplish our work. And then something else that changed this year is that we do have, as mentioned, we do publish quite a bit within manuscripts. We do make those open access. And typically in the past, that has been covered by the eSTAR committee, and moving forward, that will be covered by HESI. So that'll allow us to have additional funds to be able to do more science within the eSTAR committee. So that's a great change within HESI. And then continuing our support, we expect to continue to have support for 2025 across our industry partners. Overall, I would say last year and this year, we're expecting and have had about $250,000 worth of investment, or about 250 from our industry partners. So that goes a long way to be able to help support all the great efforts that are across the organization and within the HESI that Scott mentioned for the different working groups. And part of that is really coming from the dues that I mentioned, which is about $8,000 this year. This was higher in the past, and just based off of the number of industry partners that we have been able to maintain over time, we decreased that in 2021. And so we are maintaining that amount, which is great to see, though. So hopefully that will continue throughout the future. But for 2025, it will still remain at $8,000 across that. All of the industry partners were sent the initial budget earlier in October. So, we are hoping and to have that continued support. So if you're one of the individuals who are supporting us, please reach out to your management. And after you hear everything today, please, really put across and communicate the great efforts that HESI are doing. Next. So some of what I've mentioned before was that we did have some grants. So we have a number of different funding mechanisms that we use for research. Some of them I mentioned already. So again, industry funding. This does really take time, and it really does come from those committee dues. And HESI and the eSTAR do reach out to a number of different companies. We did have quite a number of additional companies join through the OASIS consortium, which is really focused on cell painting, like I mentioned before, and ways that that can help evaluate toxicological based risk assessment. And so it just takes time to do that. So over time, we continue to try to get new partners and with us. And then we also have the specific industry contributions. As I mentioned, Oasis, that added probably at least, and I don't remember the number right off the top of my head, but it did add, and you'll learn about it a little bit later, but add, probably 30 to 40 different partners that we have, and it did increase the number of individuals that are involved in the eSTAR committee. And then with that, we also have grant funding, and just as mentioned before, the Massachusetts Life Science Center, that was an open grant. And again, we did that in collaboration with the Broad and the MIT. And that was a great contribution to the eSTAR committee. And then also we're able to secure an FDA grant in the past to support the EGX DDI working group. And that's really supporting a ring trial that hopefully will be submitted to the FDA for looking at various different markers of carcinogenesis and moving forward. So that was another great effort from this group. So if anybody knows of any other ways that you can think of that we can secure additional funding, whether you see grants pop up or different types of opportunities, please reach out to us. We would love to be able to get additional information so that we can reach out to those groups. So please feel free to put that in the chat here. And in the future, if you come up with anything or see anything as you're searching the internet or, on LinkedIn, you see something come up, please reach out to an individual on your work group or directly to Connie or Chrissy. We would love to be able to follow up on those. And so our goals for today are really to, have three, and we have a lot of different work groups, but what we're really trying to do is to highlight the different accomplishments that the various different work groups have had throughout the year. The work group chairs will be going over each of the programs that we have, all six. So we're hoping that you'll get a good sense of what each of them are doing. And again, if there's anything or any group that you do want to join, if you're a member of eSTAR, please reach out if there's something that you see. And then also we're going to review the various different opportunities and ways forward, based off of what the committees are presenting and how we're going to hopefully move those forward in the future. Looking at those various different reports. And there's a lot of great new information that's going to come. There's a lot of great new efforts that are getting proposed through these working groups. So I think that moving forward, we still remain within a really good spot. So hopefully you enjoy that. And, any questions or anything, please reach out even after the meeting. And then this year we also have, we're learning about a lot of new different topics. So we have a lot of short talks that are going to really teach us, hopefully, and learn a little bit more about opportunities in the systems biology approaches. So we have those, and I have those on a follow-up slide to just quickly overview them. But I think it's a great agenda today, so hopefully everybody enjoys that. And then something that we did want to bring up, as Scott mentioned, we typically have the leadership team, and that usually is two chairs, one from the private sector and one from the public sector. As you mentioned, we do have a rolling involvement in that. So they are typically 3-year increments when you become a member of that. And just throughout our discussions throughout this year, there are a lot of different areas, as you had noticed, that, there's academia involved, government individuals are involved from FDA and other international groups. And one of the thoughts that the leadership did have was that perhaps we should increase the representation on our leadership group so that we have each of the different groups represented. So what we're going to do today is a thought that instead of just having two, we're proposing to have four. So those representing academia, government, the pharmaceutical industry, and also the pesticide industry. And so what Connie is going to do is really conduct a survey now. So I'll pass that off to her. And we would just like to really know your thoughts on this, because we'd like to get the eSTAR committee and what you guys think about this. And we can take those results and then come up with a conclusion as to how we're going to move forward, if we'll stay with two or if we'll increase. So passing that off to you, Connie.
Yeah, thanks for teeing that up, Deidre. Maybe we can pause to see if there's any initial reactions or questions about the proposal. If not, I do have a poll I can launch. I see a thumbs up from Adam. Yeah, and part of the idea is kind of, you might have said this, Deidre, but just our stakeholders are diverse, and we wanted to make sure our kind of industry chair reflects that by having two. So I'll launch the poll. We can still have discussion, but if people already know their answer. So that should pop up. If you don't, I know sometimes certain firewalls don't let them see it. So if you agree or disagree, you can just write it in the chat. So we might just give that a few seconds for that to roll in. I'm seeing some responses. I don't know, Scott, I saw you come on camera if you wanted to add any background on your thoughts.
Well, I think it's all how we deal with risk. I think the addition of Pharma has a unique perspective, and I think I particularly take this from the point of departure group. The current way that the point of departure approach is outlined would not work in Pharma because you have to have bioactivity to have a drug. And so the way we view some of these new technologies and approaches is going to be different. So it's important that we have particularly that perspective along sort of the risk continuum. And then on the academic side, it's the opportunity to bring in really innovative ideas. And I think so that's what we're trying to balance out in thinking about these sorts of issues. We'll all apply them with different degrees of confidence and utility. And so having those perspectives would be helpful.
Yeah, thanks, Scott. So folks can continue to vote on that. If there's strong feelings either way, or if there's questions, folks, so Carol said, I agree with having diverse perspective. This is one approach that could work. I'm just worried about depleting the leadership pool. So Carol, do you think like if we had four, we would then have trouble finding replacements each time?
Yeah, that's what that's what I was worried about. Finding four leaders to continue the cycle of leadership could be challenging. I love the idea. I'm just worried about how practical it is to always find people who are willing to step up into those roles. So that's why I'm one of the not sures. Happy to go with this if you think there's a sufficiently robust membership who's willing to fill these roles, though.
Mm-hmm. Thanks, Carol. And Cam asked, I know some people are having issues with voting, so yeah, feel free. And Cam, you asked if those perspectives are both best received at the work group levels. Do you want to expand on that?
Yeah, details about how things could be used. I guess they can come from the leadership level. As a former chair, I always viewed my role as leading the entire group and not necessarily leading the details of specific working groups. And I agree with Carol. Going to four, I'm not sure what the pool is going to be like over time.
Thanks, Cam. Okay, this might be something, I know people are continuing to vote or put their answers in. It might be something we need a little bit more discussion and thought to. I don't know if Deidre or Scott, you have other thoughts right now.
Yeah. I mean, I guess my thought is I definitely understand Carolyn Cameron's, points. And I think that that's something that we'll have to go back and follow up and just have a deeper discussion about. I would say having, participated over the, past 3 years, I think that, we really do try to, again, cover, the thoughts of, all the different industries in that. And I think sometimes, in the past, the last 2 years we've had that farmer perspective and, we were very balanced. And I think, moving forward, it's sometimes good to have that balance. So just something that will, take back. And, we thought that was good to at least have some perspective. And so I don't know, we'll move forward. I mean, my thoughts are that it's good to have greater perspective if we do think that we'll have enough individuals, but really taking into account what Carolyn said.
Mm-hmm. Okay.
Yeah.
Oops, sorry.
Sure. So I was just wondering if you could just make it sort of an either or, minimum of 2, maximum of 4, and I was just wondering for those who've served before, to address Carol's concern, can people do double duty where they could be like a subcommittee co-chair and on leadership, because the leadership is more spread out, then maybe that would allow people to do sort of a dual role.
Yeah, that's a really good point, Peter. Yeah, often it ends up happening someone is a work group chair and then also might be a lead or may take turn as that. So Carol's done that, Scott's done that, a few other folks like Hydron. So that's definitely a possibility. Then the hard thing is though, you're taking the same people's time. So it's definitely a possibility, but I also understand when sometimes it's the same folks leading the groups and then chairing the committee, their time gets more sparse. But I like the idea, Peter, that we can have between 2 and 4, and maybe it's based on what we can get if there's the right person for the role. Do you have any thoughts on that?
The 2 would be incumbent upon the 2 to recruit the additional 2.
And I think, across our groups that we have, I mean, we do have a lot of the same people, I would say, that do go across all the different groups. So I think, having this meeting and, having you all here, there's a lot of opportunities, I think, across the different groups to get, more involved and to reach out to your companies if possible, to have, perhaps, there's somebody in your group that wants to be more active, or maybe somebody hasn't joined yet. So I think that just sort of also reaching out and seeing, getting a greater diversity across the various different companies who are involved, I think would be great as well. And perhaps that could increase our pool, in the future. It doesn't have to be somebody who I would say has a leadership role within, any of the working groups right now. So if, you're on the groups, I encourage you to, reach out to your organization, perhaps reach out to the eSTAR group, because there are, there could be different opportunities for you.
No, well said. And then Cam made a good point that probably the perspective we're missing the most is academic. We do have academics involved, but yes, that might be the one where, bringing to the table for more the applied piece might be something we need to be thoughtful about and thinking about who we have involved. I think we have some good folks, but then it's also time as well. David also said, I think in support, interesting to have broad perspective for synergy building at the same time acknowledging the differences and commonalities. I think that's totally right. That's part of why we thought about doing this. I think Scott articulated well, thinking, there's kind of big differences between what you do in ag chem and maybe industrial chemicals versus what's done in pharmaceuticals, and how do we learn from each other? Okay. This is a good discussion. I think we at least have an initial poll, to come back to, and maybe some more discussions, and then maybe some targeted outreach to a few folks to see interest is kind of what I see as next steps. Does that fit for Scott and Deidre and John? Yep. Okay.
Works for me.
Me too.
Okay. Deidre, do you want to take this last one?
Yeah, sure. Do you have it up yet? Hold on.
Yeah, I should be sharing. Do folks not see my slides anymore?
We're seeing your poll.
Yeah,
Oh, really?
I still see the poll.
Okay, let me stop and I'll share the slides again. Sorry about that.
Okay, so as mentioned before, that what we'll also talk about today is really some different areas that are outside our portfolio. So these are scattered throughout the day, and really looking at submitted talks. So we asked our our eSTAR committee if there was anything and that they thought that was important that they wanted to bring up and really give us some insight into that. So today we'll be hearing from Dr. Brett Howard, and really looking at the AOP reference library compounds and really an update on that. So he's from the US Pharmacopoeia. And so I think that'll be a really interesting talk, looking at clonal expansion, as Scott mentioned before, from Barbara Parsons from the FDA and those efforts. And then also looking at the cross-platform project on MPS, and really looking to see what the updates are from that, from Dr. Megan LaFollette, and she's from the 3Rs group. So we're really looking forward to being able to hear some additional insights, and looking at these different areas, really hoping that those online would think about that we could potentially have additional projects in the future. Some of these are just updates, but think about how these can apply moving forward. And then we also have a keynote talk, and I'm really excited about this. I'm involved in some efforts for this as well, and from Dr. Michael Roberts. He's the Chief Scientific Officer for the International Space Station and the National Laboratory, and really hearing some talks about some of the innovations and different opportunities there are to do experiments in low Earth orbit. So really looking forward to that talk. And then before I just go over and introduce Keith in our next step, I did just want to thank everyone. I had a great, was really, I guess I had a great time, really being involved with the leadership of HESI. So I did want to thank everybody from the eSTAR committee and all the different work groups. I will stay actively involved in all the different work groups and be able to be there and continue helping to support. So I really appreciate all the time I've spent, and thanks everyone for all your great efforts and all the posters and everything that you give presentations. And it's been a pleasure, and it's really great to be able to represent all the different aspects and all different industry, academia, government partners. So thank you for allowing me to do that for the past 3 years.